So we can see highlighted there all of those lumbar arteries. Remember, that's going to be coming off the posterior aspect of the abdominal aorta as opposed to coming off the lateral aspect. And then as you can see right through there, if we get rid of that anterior longitudinal ligament right here, we can see that it's just sitting right there on top of the lumbar vertebra. Now, as this continues to go down, it's going to come to the termination point where we'll see it branch into two different sides, and we'll also see the median sacral artery pop off. So let's add that on. So right there on top of the sacrum, oh, I should have went and highlighted it. We can see that artery right on top of it in the middle. We're gonna have to do this. All right, there we go. So you see right there, now that's coming off the posterior aspect as well. So you have those lumbar arteries, they come off the backside just like the posterior intercostal arteries came off the backside of the descending aorta. And then here at the termination point, we find that median sacral artery. Now the next thing we're gonna see is the iliac arteries. So we're gonna just put in iliac and we'll add them all there. So as this terminates, we come to the common iliac artery, change it to a white color. And then we can see these next two branches. One stays external, and we can see that it's going towards the inguinal ligament. Remember, that is our external iliac artery. And then one's gonna go inside the pelvis, right through here. So as we look inside towards the sacrum, we can see the internal iliac artery. And that's the termination of the abdominal aorta. As it passes under the inguinal ligament, it's going to become the femoral artery. Remember down there at that femoral triangle, we have this right through here. Remember our triangle? Right through there. You're going to have that navel, which will be the femoral nerve, artery, vein, and then the lymphatic vessels will travel. So remember that mnemonic navel as it passes under the inguinal ligament. We don't need to know that because it's not on our test, but it's just good to remember that stuff. Now, there's a couple of variations that we want to take a look at when we talk about the veins versus talking about the arteries. There's not many of them, but one of the big ones we want to talk about is going to be that left gonadal vein is going to be different from the other vein. Let me see what's the best way to do this. Oh, maybe. Yeah, that's the best way. Let's go here. Let's go to great vessels. Our inferior vena cava, set our renal veins. So right here we've added in the inferior vena cava. We'll make it a nice little blue color. And then off the side we can see the renal veins. Nothing special there. It looks pretty much similar to the other one. The thing that's going to be different is that coming off that left renal vein, we're going to see our left testicular vein. So if we look there on the left side, you can see right there, that left testicular vein comes off the left renal vein. But if we look here on the right side, you can see that the right testicular vein is coming off the actual inferior vena cava, which is similar to what we saw when we looked at the abdominal aorta. We saw both of the gonadal vessels coming off the aorta, but in this situation, there's a structural difference. Now, the next thing we want to make sure we take note of is that suprarenal vein. So let's look for that. And remember, with the vein, there's only one. There's not a superior, middle, and inferior. There's just suprarenal vein. So we'll add the gland onto there. And then let's see, there's the suprarenal vein. Oh, it's not on here. So let's draw it. We can't see it on the models for sure. We saw that yesterday, but we're going to see coming off of the renal vein here and going up into here, the structure like this, and there may be a couple of them, but they're all going to feed in from that one common source. So remember, we said yesterday, if you see the vein, it's just suprarenal vein. There's no middle, inferior, superior. Okay? Any questions about those? Let's take, bless you. Let's take a look at the portal vein. Did we see the portal vein last week?
I think so.
Did we see that on the table? I think we may have seen it on the model for sure, but I don't know if we saw it on the portal, on the cadaver or not. Jess, that when you're looking at it, use the high resolution model so that you can get some pretty good depth and detail when you're looking inside of it. Otherwise, you get really pixelated views. So remember we said that if we had anything tagged out here, that would be the renal cortex. So everything there would be the cortex. There's other structures there. We have arteries or veins. The nephrons are in there. The cortical nephrons are in there. But none of those are important because they're not on our list. The next thing we had tagged was a renal pyramid. So remember yesterday when we looked at it, it looked a little more like a pyramid itself. It doesn't look as much like that here, but you can still see the similar shape. So number 2 is that renal pyramid. If we look at the very tip of a renal pyramid, this one's kind of a good one because you can start seeing it change colors through there, but you don't really see it stop. But let's say like right here at the tip of this guy, see there right at the very tip, that would be where the renal papilla is. So remember, we had the renal pyramid, looks just like this. And then at the very tip, we said that it was going to kind of change a little color. A little lighter color, and that's the renal papilla. And then we said each one of those renal papilla, we're going to have something that's going to kind of drain off of it, right? So we have the minor calyx right there draining an individual renal pyramid. So number 1, we can see the renal cortex. Number 2, we can see a renal pyramid. Number 3, we can see the renal papilla. Number 4, here is a minor calyx. Now we know it's a minor calyx because when we look at it, it's singular, right? It's only draining one spot. But as we look down here, we can actually see that there's actually a number of these all that have come together. So we can see that this one, and there's one over here, they've all kind of come together to this one area. So this area would be a major calyx. So wherever we see 2 or more minor calyxes come together, that would be a major calyx. Now those are going to feed into the renal pelvis. Why did you do that? Yes, thank you. Maybe if I do this, then I can't color it. You can see it here. It's the renal pelvis. So all the major calyces are going to drain into the renal pelvis. We'll put a tag there. That'll be number 5. And then all of those are going to feed into this structure, which is the ureter. Not the artery, but the other structure, which is going to go down to the bladder. Now, in between each one of our renal pyramids, we saw yesterday that there's some tissue. That tissue is the renal column. So we can see the renal column right through there. We said that surrounding each one of the renal, or excuse me, one of the minor calyx would be the renal sinus. So surrounding that would be the renal sinus, but we don't really see that. I mean, technically we see it, but I can't really tag it because of space. Any questions about anything with the kidney? There were 8 structures. Let's see. Cortex, pyramids, the column.
The sinus thing?
The sinus, yeah, because I can't really tag that, so I guess that is an 8 thing. Maybe that's what I'm
Isn't
thinking.
there like something granule?
Well, there's a glomerulus, which is a portion of the nephron, but that's not on our list, so we don't have to worry about that.
The hilum and the...
The hilum is the entry point. So again, just like the hilum of the lung, just like the hilum of the spleen, where these vessels enter into here, or where we have the ureter exiting or the vein exiting, that's the hilum. So maybe that's the last thing. Yeah, I'm pretty sure. I think that's everything. Any questions about any of this before I minimize it? And I'm just going to minimize it. It'll still be up here if you want to take a picture of it in a minute. The muscles. So let's get rid of the ones that we know. So if we start here, we can see the psoas major. And on this cadaver, we see only a psoas major. We don't see a psoas minor on top of it. And that's normal. Right beside it, we see the quadratus lumborum. And we said yesterday that the psoas muscle was going to join together with this muscle, which is our iliacus muscle. And when those two join together, they become the iliopsoas, and they insert at the lesser trochanter. What motion did we say that was responsible for? Hip flexion. We said once we go beyond 90 degrees, though, what happens to the hip?
External
It
rotation.
begins to externally rotate. So upwards of 90 degrees at the hip, we're in straight flexion. But as we go beyond that, we begin to also internally rotate because that muscle is attached to the lesser trochanter. Now, as we look up here at the diaphragm, we remember that there's several holes in the diaphragm. So one of the first holes we see is very high, and it's on the right side, which is where we're going to see our inferior vena cava pass. So there on the right side is the caval hiatus at T8. The next one that we see is going to be right in the middle at about the area of T10, and that's where the esophagus is going to pass through and join together with the stomach at the lower esophageal sphincter. So that is our esophageal hiatus. The last opening through here is where we see the abdominal aorta pass. So that is our aortic hiatus. So again, it is possible, I'll use a model and maybe stick a probe through one of those openings and say, like, what opening is this? So you do have to know those, okay? Now, there's a couple of ligamentous areas or crossover that honestly we don't really see very well on the cadaver, but we can see the location of them pretty well. So we see the psoas muscle right through here, and if I were to take and kind of draw a line right at the diaphragm as it passes over the psoas muscle here, we get that medial arcuate line. If we look just a little more lateral, we see the quadratus lumborum, and as the ligamentous line sort of continues here, that is that lateral arcuate ligament, or arcuate line, arcuate ligament. It's a ligamentous thing. Everybody okay with that?
You said it's a continuation of the medial?
No, it's not really a continuation. It's just like one is like kind of like looped over the psoas, and then the next one's kind of looped over the actual quadratus lumborum, which is why they're separate instead of being like one continuous structure. Yeah. So is it a continuation? I would say sort of yes, if we were to look at it fascially and how that all connects.
Right.
But technically, as we look at the body, it's separated.
So that's on the diaphragm?
Yep. Yep. And you'll find it right there. It's just kind of there with the ribs, and it's going over and attaching into the lumbar spine.
I've read and heard about a close association between the psoas.
Inside the pelvis, we're going to see all those muscles that we saw yesterday, but I think they're a little bit easier to see here. So the first one that we covered was this guy, which is the piriformis muscle. Remember, it kind of looks like a sideways pyramid. Give it a nice red color. Oh, it kind of loses there. That doesn't help. Oh, that tag almost makes it worse. Remove that because that's too confusing. So we said right up under the piriformis, the sciatic nerve would pass right behind it, and then combine with the posterior femoral cutaneous nerve, and they'll pass through together. As we continue looking down, we come to those levator ani muscles. I'm going to get rid of our ligamentous structures that we see right here. And then I want to highlight just the coccyx if I can, just so that we can see that anchor point. There we go. So we said that the muscles of the pelvic floor are essentially named according to what bony structures they actually attach to. So the very first one we see is associated with the coccyx primarily. So this is the coccygeus muscle. The next one that we see below that is associated closely with the ilium and the coccyx. So that is the iliococcygeus. Change that color. The next two muscles we see in iliococcygeus, and the next two muscles are all part of the levator ani muscle group. So sometimes you'll see them written just as levator ani muscle group, and you won't see the individual muscles, but we're looking at each one of the muscles. So the next one we see goes from pubic bone to the coccyx, which we can see right through there. So that is our pubococcygeus muscle. And then a little more medial, we have the puborectalis, which we see wrapping around the rectum. So if we look right through there, we can see it kind of wrapping right through there. Now remember on the model, when we turned the pelvic floor muscles upside down, it was really easy to see it wrapping around the rectum. But don't forget, we really are going to see it from the inside. That's just a representation for the model. So you're going to see them all from the pelvic inlet. You can see some of it from the outlet as well, like if you're looking from underneath up, but you're going to see it better this way. Now there's a couple other structures we needed to be aware of. One was going to be our obturator internus. And if we look here at the obturator internus, you can kind of see there's like a circle, like an opening through there, because we have structures that pass through there, if you remember, like our obturator nerve. Let's get rid of the membrane and look a little deeper. And when we do that, we see that obturator internus muscle. And we can see really clearly that there's a structure that's separating out our levator ani muscle group from our obturator internus. Okay, and that's the tendinous arch. So again, I really like these pelvic floor muscles from this point of view because I can color them all, we can separate them out, it's nice, it's easy to see, and you don't have to really stretch your imagination to see what they are. So they're nice. Anybody have any question about those pelvic floor muscles?
Wait, what was the ligament?
The ligament, is the tendinous arch. The very first nerve we can see right through here is our subcostal nerve. Right through there. Turn it up just a little bit so we can see where it's coming from. And then we said our next nerve was going to be what? Yeah, iliohypogastric. So we can see our iliohypogastric right through there. Let's see if we can move this like right on top of it so we can see that. I almost want to get rid of that. Let's get rid of that. It's too big. It's taking up too much space. So there's our iliohypogastric, and then let's see our ilioinguinal nerve. So we can see that just below there. And here in this situation, we can see pretty clearly that ilioinguinal nerve actually passing through the inguinal canal. Still no. Where's the thing? Oh, yes.
Last try.
It's the first try. Ilioinguinal nerve, and remember we said high, H-I. The H is on top. So what is the thing, the some idiots in Georgia? So the next one's our genitofemoral, right? We said the genitofemoral was going to pierce what? The psoas muscle. Now it is also going to do that as part of that genital branch.
Later, right?
Yeah, later. But here, like, we can only see a piece of it because after it passes through that psoas muscle, then it's going to change and branch into the femoral branch and the genital branch. It's coming from the roots of L2, 3, and 4. And then as we kind of turn this to the side, you see that obturator muscle, that obturator internus, and do you see that there's a nerve right on top of it? That nerve that's right there on top of it is the obturator nerve. So remember, we said we would see that passing through the obturator canal. It's going to go to our adductor side, kind of close to the groin, and supply some of the skin or cutaneous innervation through there. Let's see, did I already do yellow? And it's already, yes, it's already tagged too. The last thing we wanted to see was the combination of L4 and L5 joining together. So if we look here, we have the sciatic nerve. That's not really going to help us, though, is it? Let's worry about L4 and L5 on the model, and let's not worry about it on the cadaver. You can see it, but this is our last rib. And so we see the subcostal nerve If you just tag the lumbar plexus on the cadaver table, it won't include this nerve. We include it because it's going to give a branch that's going to go down to the L1 and join together to give us on top the iliohypogastric and then the ilioinguinal. Remember, if you turn your fingers like this, make the peace sign. Hi, what's up? Okay, hypogastric on top, ilioinguinal on the bottom. Okay, ilioinguinal, of course, is going to go all the way around to the inguinal canal. If we look through here on the side, you can see going right up under where the ASIS is, or rather would be, is the lateral femoral cutaneous nerve, and that's going to go to the side of the thigh. And we said that if someone had a belt that was too tight and constantly compressing through there, they could develop something called neuralgia paresthetica. One of our former teachers here, I think he was maybe from South Korea, and in the military they made everyone carry a shovel, and so he actually developed that as a result of carrying that shovel. I guess it must have been a heavy shovel, but he wasn't aware of it until later on when he was in school and he couldn't feel there. Now if we look right through here, we can see the psoas muscle, and piercing the psoas muscle up here is the genitofemoral nerve, but it's immediately going to branch after it pierces through here. One is going to continue down to the femur as the femoral branch of the genitofemoral. This guy is going to continue on down as the genital branch, but we don't have to worry about that for our final, right? We said we only need to worry about genitofemoral nerve. If we look right through here where the psoas has been removed, we can see the femoral nerve right through there. And we said that the femoral nerve was going to have the branches from L2, L3, and then L4. And we said that was going to be the exact same situation for this nerve. If you can see it, it's right here. And we said that that was going to pass through the obturator foramen as the obturator nerve. Okay, so obturator nerve has the same origin as the femoral nerve, and that's helpful because if you trace here, you can find this other nerve coming off of L4, and where it joins together with L5, just where that next finger is the lumbosacral trunk. Okay, so again, subcostal, iliohypogastric, ilioinguinal, genitofemoral, lateral femoral cutaneous nerve, femoral nerve, obturator nerve here, and then the lumbosacral trunk. Okay, and that's all you have to know, right?